Turning now to your community focus, as we've been mentioning, it is Veterans Day, and there are plenty of events throughout our area honoring those who have served. Joining us live to talk about Veterans Day and the issues impacting veterans, John Loughlin. He's the Public Affairs Officer with the Providence VA. John, thanks so much for being here.
Thank you for having us. I appreciate it.
Well, let's start with the basics. Tell us a little bit about the VA Providence
Sure.
healthcare system and exactly who you serve.
The VA Providence healthcare system is composed of the main hospital, which everyone's familiar with on Chalkstone Avenue in Providence. And then in addition, we have community-based outpatient clinics. We've got one in Middletown near the Navy base. We have one in New Bedford, Massachusetts, and we have another one in Hyannis. We service not just Rhode Island, but also the Cape and the islands as well. We service roughly 37,000 veterans who are registered to enroll in the VA Providence healthcare system.
That's incredible. And John, you're a veteran yourself. I wanted to ask you, what do you think is the biggest issue impacting veterans right now?
Well, I think it's veterans don't realize that they've earned this benefit. When you're on active duty and then you leave active duty, there isn't enough preparation to tell you, hey, by the way, you should go talk to the VA. And so you kind of have to find it from friends and other veterans that you happen to know, and then you work your way in there. But it's just so important to enroll for VA healthcare benefits. And the reason I say that, and a lot of veterans say, you know, I have private insurance, I don't need to do this. Every veteran that enrolls increases our budget, and we're able to service more veterans and add more programs. So you're really helping each other out, and it doesn't have any impact on your private insurance.
Now, John, we've been reporting on the recently passed Pact Act here on 12 News. What is different about this, and how will it impact everything at the VA?
Well, Kate Walsh, by the way, did a great job on that package on the Pact Act. The Pact Act basically expands the number of presumptive causes of illness for veterans. So for both Vietnam veterans, but primarily adding Gulf War veterans who may have been exposed to burn pits and some of the toxic chemicals that are involved in burn pits. So that now, if a condition happens, we can definitively say that it was linked to service. That makes it service connected. That makes it eligible not just for health care, but also for VA disability benefits.
And Kate, in her package yesterday, was asking if anyone in Providence has come forward yet to sort of take advantage of that benefit. Have you seen any of that yet?
We're starting to see that now. Yeah, we're starting to see small numbers coming in. Getting the word out is helpful, and so we certainly appreciate that. But again, if you're a Gulf War era veteran, I would encourage you to immediately apply for disability benefits and to register for VA healthcare, because that's how the whole process starts.
And John, just quickly before we let you go, what's your message to fellow veterans on this Veterans Day?
My message to my brothers and sisters in arms is thank you very much for your service. Thank you for being there for all of us, and enroll in VA healthcare system. It benefits you, and it benefits your brother veterans as well.
John Loughlin, thank you so much for being here, and thank you for your service.
Thank you.